Hello and welcome back to another MedRevisions video. Today we'll be discussing an August 2021 recall and give you some helpful tips for the upcoming exams. And hopefully that will bring you one step closer to passing the PLAB 1 exam. Alright, let's dive right into the video. Before we discuss the question, please take 50 seconds to pause the video and comment the answer down below. Okay, let's get to the question now. We have a 52-year-old man who is brought to the emergency department by an ambulance. On examination, his neck veins are widened, heart sounds are muffled, a trachea is central, and chest x-ray shows cardiomegaly. He has a systolic blood pressure of 83 and a pulse rate of 131. His past medical history includes a myocardial infarction a week ago. What is the single most likely diagnosis? The correct answer is cardiac tamponade. Cardiac tamponade. So let's see why that is the correct answer. Okay, but before we discuss the other options, don't forget to smash that like button. It wouldn't even take a second. Come on, what are you waiting for? Also, comment down below on any other topics you'd like us to cover in our future videos. Make sure to check out the reviews from our past PLAB 1 candidates. The link is in the description below. Okay, so back to the question. The correct answer, as I said before, is cardiac tamponade. Now, this question is a classic example of cardiac tamponade, obviously, and it's showing us the Beck's triad. What is the Beck's triad? That is muffled heart sounds, distended neck veins, and hypotension. That is your Beck's triad, and it's a classic finding in cardiac tamponade. And with cardiomegaly on chest x-ray after myocardial infarction, this would be a typical question that you would get if they were to test you on cardiac tamponade and other such cardiac questions. So don't forget the Beck's triad, muffled heart sounds, distended neck veins, and hypotension. Alright, so why is it not Stressless syndrome? Now, Stressless syndrome would typically present after 2 weeks of post-MI, myocardial infarction, and it would also have ESR, high elevated ESR levels, and also pleuritic type chest pain. Acute pericarditis, on the other hand, is quite similar, but would typically present after a few days of myocardial infarction, and also they would present with fever as well. Now, what about tension pneumothorax? Tension pneumothorax would present it with a deviated trachea and also reduced air entry on one side. Okay, so that is not the correct answer either. And finally, diaphragmatic rupture. Diaphragmatic rupture would have, or we might be able to hear lung sounds, abdominal sounds in the chest. Okay, so that is one of the presenting features of diaphragmatic rupture. So that is not the correct answer. Cardiac tamponade is. Alright, so that's it for this question. And I hope it was clear for all of you. Thanks for watching. This video was brought to you by MedRevisions, your go-to resource for PLAB Part 1. Complete your revision with MedRevisions.